So Anastasia, are you also going to, you will repeat. Okay, that's fine. So can you see the presentation and hear me as well? Yeah, okay, that's fine, great. So I will just introduce myself really briefly. My name is Joanna Wróblewska, as Anastasia mentioned, and I am an expressive arts therapist and a visual artist living currently in Belgium, in the Flemish-speaking part, not the Dutch-speaking part of Belgium. I am originally Polish, and my family is a family that was displaced from Western Ukraine just after the Second World War. So this is a part of my history. And nowadays, I mostly work with migrants, with refugees, and with people who find it difficult to belong to a place where they are currently. And so today in this presentation, I'm going to speak about the understanding, the importance of understanding of specific cultures and creating cultural awareness as one of the fundamental competencies that is really necessary when practicing during an ongoing crisis and war. And so we're going to look at a couple of things, and of course, this topic is really huge. But just a couple of things that I would like to emphasize today would be to looking at how people typically respond to disaster and crisis, and especially to a crisis that Ukrainian people go through right now, to the war. What is the role of trauma-informed mental health care in that context? And also how we might take care of ourselves, in the time when we provide help for others, which is also a really important thing and a really essential thing while we help distressed groups. And before we go into this presentation, I would like to offer you a little bit of a grounding exercise. And Anastasia already mentioned, remember to drink water, remember to take care of yourself as much as you can. But I would also like to invite you to sit well on your chair, really comfortably, to feel the heaviness of your hips, to put your feet on the floor, if possible. And you can close your eyes if this feels comfortable just for a moment. And take 3 deeper breaths. And you might want to release your jaw, your joints, and just move your jaw a little bit to one side and to the other. And if in any point of this presentation you become overwhelmed, you can also ground yourself by finding the directions and looking into 6 different directions. And you can do it now together. So looking to the right, looking to the left, searching for exits, doors, windows, looking to the back, from one side and from the other, looking to the front, noticing what's above you, and what's below you. Moving your shoulders to the back and to the front. And just knowing that you are here in front of the screen with your physical body. And as we're going to speak about things that might be difficult sometimes and might feel heavy, you might want to put your hand on your heart and another one either on your belly or on your face, on your cheek, to stay in a connection with yourself. As you keep connecting to your emotions and to your physical body, I would like to read to you a poem that I wrote after one of the workshops conducted in Krakow, Poland, for Salam Lab, one of the organizations providing help for Ukrainian war refugees, but also for other people, for Afghan war refugees and anyone who really needs support on the way to a safer life. And this poem is called Our Home. And it has a subtitle, The Fragments of Where We Belong. Our home. Love, warmth, coziness. Family, togetherness, safety. Memories of Ukrainian embroidery and birds singing the songs of Afghanistan. Our home. Love, warmth, coziness. A place of refuge and stability. Memories of world without war and peaceful moments together. Best memories of home can coexist with the images from war. And as we express what can't be put into words, something emerges. It is hope. And this is a poem written using the words that people who I worked with in the workshop offered to me. So it's a really great gift to me and also to the whole community, I think. And I'm really grateful every time I share it. So going into the presentation, the importance of cultural awareness and trauma-informed mental health care in times of ongoing crisis and war. And I would like to start with the quote, even though there is universality to crisis, culture plays a strong role in how crisis is interpreted, both for the crisis intervener and the person in crisis. This is why it is so important to speak about the cultural context and the culture of people who are in crisis, to be able to help them properly and not to cause more stir and more harm and more unease. So let's go to the next slide. Oh, this is the previous one. So yeah. And so traumatic events do not exist in a vacuum. Like other social phenomena, they should be understood within the social and cultural context in which they occur. So we're going to move on into some important things about possible disaster or crisis phases and responses. And as I find it important that we can orient ourselves within this topic and see, where people are right now, and just, even in a retrospective, see what happened and what is happening right now. So we can move to the next slide. And I would like to introduce to you, and probably most of you know it already, but just also as a reminder, the stages of crisis. And so there's different ways of speaking about the stages of crisis. And I wanted to propose to you to look at those two that are on this slide, which is either the division into 4 or the division into 7 disaster phases or stages of a disaster. So first, it's like 4 stages, and there's a pre-crisis stage, which is a stage where people in a way feel or know that something can happen, but the event didn't happen yet. And so for some of you, you can we can remind ourselves the period just before the war started. And even though we know that the war was actually going on already in Ukraine for some time, the date of 24th, right, of February was the date when the war started. And just before that, many people still hoped it's not going to happen. Some knew that it's going to happen already, right? So there was this period before. And then we have the crisis stage. And the crisis stage is really the acute stage. So this is the crisis itself. And there's no turning back at that point. So there might be a sensation of feeling the ground, events occur fast, there's a lot of damage. It's not possible to ignore the situation anymore. There's a feeling of lack of control over what is happening. And things happen very, very fast. And then there's the third stage. It's the response stage, or a chronic phase of a crisis. And you know, it's very interesting. When I was reading about it, it was mentioned during the chronic crisis stage. The media usually shift the script from what's happening to who to blame. So this is one of the important, interesting and important things about this this stage of a crisis. And also, yeah, it might be that in this stage things get a little bit more stable, and they might be, it might be a period where they can still go wrong and go better depending on how the crisis is managed. And of course, this relates to not only to war, but any type of a crisis. So we need to adjust it also to the war situation, right? And then this is a place where we are not there yet with the Ukrainian war. It's a post-crisis stage, and this is a resolution phase, and this phase can last in some situations for a couple of months, and in some situations it might last for years until you know, some kind of stability enters a specific community, and there's some resolution found to what happened. There's some healing also happening. And another division is into the 7 disaster crisis phases. This is also a very interesting one. So again, we have the warning or a threat phase, where there's a potential risk of a conflict, there's a potential risk of a disaster, but it didn't happen yet. And then we have the phase of the impact. And of course, depending on the characteristics of the disaster, reactions range from confusion, disbelief, anxiety, also up to shock and hysteria. So there might be so many different reactions in the face of the impact. And then we have this phase that is called rescue or heroic. And in this phase, individuals' activity levels are typically high, oriented towards rescue operations, survival, and perhaps also evacuation. So this is also something that we could observe in many types of crisis situations. Then there's the remedy or honeymoon phase. And during this phase, there's optimism arising in communities, in individuals, as governmental and volunteer assistance becomes available. So the interactions between relief workers and survivors, or people in crisis, or from different cultures, can be important. And there's a strong belief that there's gonna be some solution coming. And then we have the inventory phase. And during the inventory phase, survivors recognize the limits of help, and they see that even though the help is provided, not necessarily it's going to solve the crisis, not necessarily the conflict is going to be solved. And the initial optimism somehow dissolves, and there's a certain level of discouragement and fatigue. Also high levels of grief and loss. And then there's the disillusionment phase. And this occurs when survivors recognize, or people in the crisis recognize, the reality of loss and the limits of the outside relief and outside help. And this phase is characterized by high levels of stress that can be manifested in personally destructive behaviors, family disorders, community fragmentation. So all those very, very complex and difficult processes that lie behind this phase. And then there's the reconstruction or recovery phase, the final phase that can last, again, years. The phase that involves the rebuild of communal or community structures, the integration of the trauma that was that people went through, and coming back to some kind of an equilibrium, some kind of a balance. And we can move to the next slide right now. So there's a bunch of different reactions to possible crisis, and of course it's important to realize that most of them we can only imagine how they feel, right? We can only describe them in a certain way, but the way we describe them is never full, right? Because we can't fully understand what the other goes through. So just some of them, just to sketch it a little bit: intense feelings, rage, fear, anxiety, guilt. And guilt is one of those really difficult ones, also for those who left the war zone. Our families were separated, for instance, right? People who are safe physically, relatively safe physically in a country that somehow protects them, that managed to leave, but at the same time they feel huge guilt, sometimes shame, that they're not there helping, that they're not with their families, they're not with the men fighting. So this can cause a lot of emotional stir in people, a lot of strong, intense emotions. Also, behaviors and thoughts affected by the disaster or crisis. Sometimes people start to behave differently. The strong emotions influence their thoughts, they influence how they behave. For instance, children lose their ability to play. My experience with displaced families, also with refugee families, is that very often children take the responsibility for emotionally for the problems of the parents, and they completely lose the ability to stay kids. They try to solve issues that they can't really solve, and that causes a lot of anger, a lot of internal tension, and a lot of issues that then have to be taken into therapy. Then strained relationships or conflict with family and friends. And here I have one example also from my work with Ukrainian war refugees in Poland, in Krakow, where there was a very, very young woman who was sent by the parents from Ukraine to Poland. And then in Poland, she made plans for her education, like further education in the future. He was supposed to come, she was supposed to study, and he was supposed to come in 3 years, so a relatively long period of time. And her family stayed in eastern Ukraine, and they were under attack. They had to hide in the basement, and in this period where their life were threatened, there was a conflict between the girl and the parents and the grandparents about what she's going to study. So for her, it was a very difficult situation. She could see how surrealist the situation is. Like, their life was under a threat, but at the same time, they fought over, her educational choices in a different country. So that was a very difficult experience for this young woman that I've met. Then physical symptoms of stress and trauma: headaches, stomach aches, rapid heartbeat, but also in a longer perspective, thyroid issues, long-term digesting issues, pain that doesn't have a physical origin. So it's really like a psychosomatic pain that has to be diagnosed for a longer period of time. Different hormonal issues, insomnia. So there's a bunch of things that come together with stress and trauma. And then psychological symptoms of stress and trauma, panic attacks, flashbacks, insomnia, concentration issues. And we can move to the next slide. And another important quote, because of the strong role that culture plays in disaster response, disaster mental health services are most effective when survivors receive assistance that is in accord with their cultural beliefs and consistent with their needs. And this is one of the things that that first aid of the soul really finds important, and this is what we try to do, provide this kind of support that is culturally informed. So let's move further. So I would like to offer to you a couple of definitions regarding culture and cultural awareness, so we all understand very, very well what we are dealing with and how to approach this topic. And before we move into definitions, you can try to stretch yourself a little bit and maybe just stretch your arms to the sides or up. Lengthen your spine, move your head, twist to the sides if you can. And as you probably know, there's many different definitions of culture, but I picked two that I found especially short and meaningful. So the first one comes from Yamamoto, Silva, Ferrari, Nocaria. It's from 97. The term culture refers to social reality. It can be defined as a complex collection of components that a group of people share to help them adapt to their social and physical world. And the other one by Alarcon, Folks and Vakur from 98. Culture is a set of meanings, behavioral norms and values used by members of a particular society as they construct their unique view of the world. So just to really take in that the meanings that we create, the behavioral norms, the values that we have are very closely related to the cultures that we live in. And those cultures in the times of disaster and crisis can become resources for people. So just we don't forget about that while we provide support. And let's move further to some other definitions that are important. And I would like to also pay some attention to the definition of a subculture, as we very often tend to generalize what specific cultures, and we often speak about Ukrainians as a whole, right, or Belgians as a whole, or Poles as a whole, or Americans as a whole, as one society. However, within a culture, we can recognize so many subcultures, and subcultures revolve around many different things and aspects of life, as gender, age, class, race, religion, occupation, sexual orientation, and identity. And additionally, of course, some of the subcultures are based also on a specific disability, like, for instance, people who have some hearing limitations, right? And it might be sometimes like a little bit blurry, like how these people can create a subculture. But imagine that in times of a natural disaster, if there's information passed to these subcultures without thinking of a language, thinking of like how to pass information to someone who can't read, for instance, because of different limitations, the information might not reach a specific subculture or a specific group, which might put their life in danger. And looking at, for instance, my experience at work with different communities, also with the Ukrainian community. There's so many subcultures also within Ukraine, so many minorities. I had the pleasure to work with Ukrainian Roms. This was the first time I did it. It was such a beautiful experience. Also to imagine that in Ukraine there's so many minorities. Like my family comes from the Polish minority, but there's also, for instance, Caucasian Tatars. There is a Muslim community. Some of them are also in Poland, right? There's sexual orientation communities that had difficulties leaving Ukraine or going through the crisis, through the work and crisis in Ukraine, and being protected. So there's so much there that we need to take into account, and there's also so much bias, right? Because we don't know everything. It's like a very long, even a lifelong process of learning about a specific culture and what is there, what does this culture contain. So we can go further. Slides. So I've already started to speak about it, but another term that is really important is cultural context, is the cultural context. So it's related to the society where individuals are raised in and at how the culture affects behavior. It incorporates values that are learned, attitudes that are shared among groups of people. That includes beliefs and meanings and customs, ideas, language, and norms. So all that is the cultural context. And without proper information about the cultural context, we might not be able to bring relevant help to specific communities. And then just to add to it a little bit more, also to remember that no matter where people come from and how, what's their financial or educational situation, they might go through a severe cultural shock. And the level of the shock differs from person to person, but also, looking at my own life, I see that even though I have so much experience with moving from one place to another, I still go through all the phases of the cultural shock, and I can observe them on myself. This is really such an amazing thing to be aware of. So a cultural shock, and especially for people who leave their country because of the danger, because of the war, is a very difficult experience. And I know stories of people who came to Poland. That is a relatively, it's a country that has a border with Ukraine. It's a country that is culturally relatively close, or is seen as a close to Ukraine. However, there were people who would cross the border and realize that in Poland, you speak a different language, that people can't understand each other, and they would like to leave immediately. So, there's different levels of cultural shock. For some, it's like just leaving this place. I don't want to be here, right? And so there's a lot of disorientation, and you start to see the bias between your own culture and the culture of the country where you land. And that can lead to many different, very, very strong emotions. It can lead to confusion, anxiety, very high level of frustration, a high level of loneliness, and of course, homesickness. And cultural shock very often has those three phases: honeymoon, rejection, and recovery. And honeymoon might be a phase of just liking everything that is around me, like just being very fascinated with the culture that we enter. And that lasts, unfortunately, very short. Then comes the rejection phase, and the rejection phase is more related to criticism or starting to notice, people start to notice differences between my own culture and the culture of the place where I came, right? And in this phase, there's very often certain difficulties around communication, around how people are with each other in daily life. And it happens, unfortunately, that people get stuck in the rejection phase for very long, if not for life. This is one of my observations. And hopefully at some point they land in a recovery phase, which is also sometimes called a bicultural phase. This is a phase where the culture starts to be integrated. So I know my own culture, I know where I come from, but I also integrate a new culture where I from a place where I live right now. And something that might be, just for a moment back, thank you. Just something that might be really interesting is also the re-entry or reverse culture shock for people who come back home from a different place after some years of migration or refuge, and they can't find themselves back in their own country because things changed and they changed. And so this might be as severe actually as the cultural shock itself. And I know many examples of people who lived for a very long time in Canada, in the United States, in Western European countries, and they would come back to Colombia, to Venezuela, they would come back to Poland, and then it would be very hard for them to settle in their own country, because they would find themselves very, very different, and they would find their country very different from the time that they left. And they would also hold a lot of stereotypes about how this country is or how this place was. And then it would be shocking as well. So just to keep that in mind. And we can move on. And so cultural awareness becomes really important. And we also have like a very nice definition here of what cultural awareness is. It's like being cognizant, observant, conscious of similarities and differences among and between cultural groups. So this sensitivity to similarities, differences that exists between two different cultures, and how we can use our own awareness, our own willingness to learn, our own sensitivity to create effective communication between members of different cultural groups. And then that relates to the next slide. Cultural competence. And cultural competence is really like a set of congregant behaviors, attitudes, and policies that come together in a system, agency, or among professionals as mental health professionals, and enables that system, agency of those professions to work efficiently in cross-cultural situations. And other definitions that are somehow related are cultural sensitivity, cultural intelligence, and cultural humility, seen as a lifelong process of discovering our own identities and identities of the others. But in this presentation, we're going to focus on cultural competence and cultural awareness. So we can move on. And so cultural competence it's one of the essential competencies and essential resources that are for the time of crisis and war. And culture, what is important to remember is that culture provides continuity and a process for healing during times of tragedy. Survivors react to and recover from disaster within the context of their individual racial and ethnic backgrounds, cultural viewpoints, life experiences, and values. So when we offer to people healing spaces, places of safety, relative safety, spaces of containment, we must not forget about that. Culture offers a protective system that is comfortable and reassuring. And here, what also creates this protective systems are stories, rituals, legends, and everything that culture contains. And what I am discovering with my clients and also for myself is that this is also not only the connection, not only to parents or to a specific nation or country, but it's also the connection to the land. It's the connection to the landscapes. It's the connection to ancestors. It's the connection to things that like food, like art heritage. So all that creates a container for people to that can offer them some level of comfort and reassurance. And we can move further. And so there's the question that arises, how to develop cultural competence, because it seems like a really complex thing. So there's a couple of things that I want to remind you. It is important to explore our own roots, beliefs, and values, and constantly check in with ourselves and see how much we can push that, how much we can learn about ourselves. It's about seeking cultural insight through articles, books, training, seminars like this one, or doing language research. It's important to interact with diverse groups, specifically with people coming from the culture we are currently focusing on. It's important to search for support of other culturally competent individuals and organizations. Asking questions never hurts, right? Speaking to people who are already culturally competent, speaking to members of the communities we are interested in, and asking them for guidance. And remembering that this is actually a lifelong process. So it's not something that's going to happen from one week to another. It's really a process that asks for humbleness, patience, and that might be at times really frustrating because, well, we can't understand it all. We can only understand some parts of it. So we can move on to the next slide. And again, just a moment to rest and maybe move, sway from side to side. And you might want to hold your face in, like on your cheeks in your hands, and even put your elbows somewhere so your face can rest really into your hands. And taking 2-3 deeper breaths. As we move into the trauma-informed mental health care in the response to the ongoing crisis and war in Ukraine. And Anastasia, we can move to the next slide. And I want to emphasize that this is a story that we live. We live inside an unfinished story of this war. And you know, so many of us were trained how to deal with post-traumatic stress disorder, right? And to offer a place of safety and containment, or hold groups who already are relatively safe. However, what is different now is that we are dealing with groups and individuals who are not relatively safe. So the question is, how can we co-create spaces of containment for people who live in this unfinished story, and how can we be with them in that difficult time? So let's move on. Next slide. So trauma-informed mental health support must be an essential part of the emergency response, and this is something that mental health professionals know better and better. And we can move further. So what does trauma-informed mental health care include? And again, a really nice quote that I wanted to share with you and offer to you. Adopting a trauma-informed approach is not accomplished through any single particular technique or checklist. It requires constant attention, caring awareness, sensitivity, and possibly a cultural change at an organizational level. And also knowing that as individuals, we can do only as much, and very often on the systemic level, we can't change things. And also we need to be transparent about that, right? With people who we work with. Certain things can't be changed, and we can do only as much as we can do as individuals, and then hopefully on an organizational level a little bit more. So what does it mean, this trauma-informed mental health care? This is a place of safety and containment. And safety comes with a question mark, because in certain situations like the war in Ukraine, we can't offer safety to people. We would like to, but we can't. So what we can offer to them is probably a moment of containment, or a space of containment, and a space of community support. Right, and I believe that this is what we do in at the First Aid of the Soul. We offer to people a place of containment and a place of community support, a community of people who try their best, and they try to bring support that is needed. Then trustworthiness and transparency, peer support groups, supervision groups, groups where people can learn something that will help them to go through the crisis, through the worst moments, collaboration and mutuality, empowerment and choice. And choice is something that very often people who were refugees or displaced people, they don't have it, they're not offered choice. So therapy spaces are very often the only places where they really have a choice and their voices can be heard and they can express what they need. Cultural and historical and gender issues. So all that is in the cultural context. And let's move on. And who needs culturally sensitive and trauma-informed support? And here, people who work in Ukraine can add to this list. And I just mentioned a couple of things, a couple of groups, sorry, that came to my mind. So Ukrainian mental health professionals, and this is what the First Aid of the Soul does already, providing help for mental health professionals in Ukraine. Children, adolescents, and their caregivers in the country and in exile. And here I would like to remind you the research done in England, I think it was in London during the Second World War by Anna Freund, about families that were separated from each other. So parents would send children to the countryside to make them safe. However, in the long-term research, the children that were separated from the parents, they actually suffered more than those who stayed with parents. There wasn't the sense of going through things together wasn't there. So very often they experience many different issues on the way into their adult life. Adolescents and students in Ukraine, adults in the country, in the exile. Ukrainian minority groups, heirs, for instance, Ukrainian Roms, activists and social workers in the country and outside of the country. And I also want to add from myself and from my experience in Poland, I've met many Ukrainians who didn't do any social work before the war, but after coming to Poland, they became activists and social workers. So those are people who also need support in knowing how to take care of themselves while they do this work, and also to learn what's the characteristics of this type of work and how much this work can influence their private life and their emotional life and the physical life, the physical reality in many different ways. And then, of course, people serving in healthcare, in military services inside Ukraine. And please later on add to this list. There's probably more and more groups that need that support. Let's move to the next slide. So what seems to be essential, and one I would like to emphasize what seems, because there might be so much more to it, but just for the sake of this presentation, professional trauma-informed support offered by culturally competent mental health professionals, respectful and culturally sensitive language. This is something that we all in the process of learning how to use a culturally sensitive language. And in my work with migrants and refugees, I feel like I learn every day, and it happens at times that I say something that is inappropriate and I'm corrected, and people are really helpful. They offer their expertise and their knowledge to teach me about the cultures, and this is one of the things that I take as a great resource, that they are willing and open to teach me. And then relevant coping strategies, strengthening resilience and helping people to express whatever needs to be expressed in the present moment. And here art-based approaches and embodied approaches can be a good alternative, as they very often allow people to express things that they don't even know how to speak about. And then opportunities for nourishment and nourishing community support and culturally sensitive connection with others. So even if I don't know, I'm curious and I want to know, right? Even if I don't know, I am willing to ask questions. If I don't know, I trust that you're going to tell me and you're going to explain to me what I don't know. And then this clear distinction between offering safety and containment. and going even farther in a more of a spirit of decolonization and decolonized psychotherapy, where sometimes safety is understood as something that we can create inside ourselves, but in many cultures, safety is something that is really offered by a community. So safety comes from the community, and if one sits in a community that is not safe and in a context that is not safe, this person can't create safety inside. So the safety has also, it has to come from the outside, from the community. And then, of course, confidentiality. And then trauma-informed mental health care inside Ukraine, outside Ukraine, and virtual. And of course, again, you can add to this list. I just tried to mention a couple of things that came to my mind. Ukrainian mental health professionals, humanitarian organizations, offline, online, and natural and organized support networks inside Ukraine. Then outside Ukraine, international, local, non-profit organizations, NGOs, communities, also individuals who add to those communities. And then virtual, culturally competent professional psychosocial support for Ukraine. There is, for instance, first aid of the soul. And we can move on. And as many of you already know, first aid of the soul delivers accessible psychosocial and emotional support services through multifaceted approaches and a holistic trauma-informed lens to individuals affected by the war in Ukraine. And here we have supervision and mentorship, support groups, trainings and workshops, online resources, and more is to come. And this is an information that is placed on the Aid of the Soul website that I really love, because it shows us as a collective of professionally trained mental health counselors from all around the world with the variety of expertise. And I really cherish this idea of being a collective, you know, because this is really a community of people. And I think what we need right now, one of the things that we need right now, is really strong communities. And to recognize the importance of peer support and self-care and communal care while serving distressed populations. We can move on. And something that we all know from the therapeutic practice and how much the work with clients and work with distressed populations can influence the way we are and the way we interact. And so there's just to be aware of the topic of countertransference and secondary trauma when working during the ongoing crisis. So the importance of intervision, supervision, peer support, and how we can speak openly without hesitation about countertransference as as something that happens a lot in therapy sessions, in therapy groups. And you know it, but just as a reminder, can be defined as a therapist's emotional reaction to the client. And there's some examples of countertransference are inappropriately disclosing personal information, offering advice, not having boundaries, developing strong romantic feelings, which can happen sometimes too. So just being aware that those things exist and they can actually influence our practice, our therapeutic practice as well. And then secondary traumatic stress, defined as an experiencing indirectly a traumatic state of stress through trauma that was directly experienced by another person. And as I must say, this was a feeling foreign to me until I started to work with refugee kids, which is a really difficult environment for me, and I'm learning really how to, how much I can do in this environment, and what are actually the limitations of this kind of work. Just to be aware that sometimes we also need support as mental health professionals, and it's not a sign of weakness. Being aware of that and working with that is actually a sign of awareness and a sign of internal strength and integrity. And also something that I really lately considered for myself, the concept or the idea of burnout described as a response to prolonged interpersonal work-related distress, but also the idea of moral injury, because many of us very often work in environments when we deal with situations that actually are against our values. So imagine activists that work on the Polish-Belarusian border. And you must know that in Poland, when refugees come through the Belarusian border, it is illegal to help them. So activists and therapists go to the forests that are, actually the border is a huge forest. It's actually one of the most ancient, the only ancient forest that is left in Europe. And then they bring help there, providing food and medical support and some psychological support. However, they can't rescue people from the forest, and some of them already died there. So it's working in an environment where you know that your values, the way you want to be, the way you want to help, are violated. And for me, I will risk the statement that this is actually causing a moral injury, and our systems are not adjusted and not prepared to deal with this kind of moral injury that is caused in activists, in psychotherapists, in people who bring help in many different places where the crisis is ongoing. Okay, I think we can move on with this one. And then just to slowly starting the closing, personal strategies for resilience. And of course, this is very general, but there's something that we can take from it, right? Like self-care, making time to engage in activities, practices that support this emotional, physical, social health and well-being, like making breaks, stretching, doing breathing. This is the simplest thing we can do. Social support, one of the most important things, having personal relationships that are genuinely caring, supportive people around ourselves, supporting communities. Knowing when to disengage, knowing how to detach from the work we do, from the clients, from the suffering of the other. Setting boundaries, creating limits around interactions with clients, with patients, with coworkers, with organizations. And I noticed that a lot with organizations that are, activist organizations where people can't really leave work. So they constantly answering emails, constantly they're on the phone, right? And that causes, of course, another level of tiredness, frustration, where they can't really serve people fully because they themselves sleep deprived, tired, and completely overwhelmed with the inability of helping as much as they would like to help. And then peer consultation, regular engagement with peers to discuss challenging cases, to receive support and to receive other perspectives. And we're going to move to the organizational level. And I was preparing, like, this is the next slide. Yeah, I was preparing this slide, and I was in my heart I was very happy because I thought that at the first aid of the soul we already do that. It just really feels great. Provide education on opportunities for safe and respectful discussion about CTS, STS, and other challenging experiences and that occur during the interactions with distressed populations. Providing time for team members and volunteers to consult regularly with peers about challenging cases. Bringing to people resources and adequate time to explore those resources. Creating a supportive network, a supportive environment where team members and volunteers can feel appreciated for their work. And I want to thank Natalie for this because she does it so well. Thank you. And then, yeah, I would like to wrap up this presentation slowly with a quote from, I don't know if I read the name properly, but Bhuwan Tapalia, a writer and poem from Nepal. My arms are always open for you. Come on it. I am peace and my surname is humanity. And we can go to the last thing. I won't go necessarily to all the points, and you have the reference also in the resources for this presentation. There's a bunch of very interesting guiding principles for cultural competence in disaster mental health programs. And so there's 9 points that they mention. And actually, they somehow summarize what I spoke about in this presentation. So if you are interested, if Anastasia, if you can move to the next slide. So developing cultural competence in disaster mental health programs. This is the first document on the resource list. This is a very good document. It speaks a lot about natural disasters, but it can be adjusted also very well to the crisis of war. So I would like to offer you those links as some kind of a support and resource. And just thank you for your time and for your attention today. And we're going to move to the panel after the break. Thank you so much.